Plastic repair of salivary duct, sialodochoplasty, primary or simple. Secondary or complicated. The physician repairs a salivary duct by inserting a hollow plastic or silicone tube into the duct. The tube is threaded through the duct. The duct is allowed to heal and may be sutured around the tube. In 42505, repair of the duct is complex and may be delayed. The tube is later removed and patency is restored. Proctoplasty, for stenosis. The physician performs proctoplasty for an area of stenosis. The physician makes a longitudinal incision through the scar tissue at the anorectal junction or may completely excise the scar tissue to an area of normal mucosa. The surrounding perianal skin is undermined and mobilized in one of several possible fashions as a flap. The flap is approximated to the normal mucosa at the edges of the incised or excised scar, thus closing the wound. Proctoplasty, for prolapse of mucous membrane. The physician performs proctoplasty for an area of prolapse of rectal mucosa, ectropion. The physician makes a circular incision just proximal to the prolapsing mucosa and mobilizes the redundant mucosa. An incision is made out onto the perianal skin to form a flap of skin on the right and left sides of the anus adjacent to the mobilized mucosa. The mucosa is excised and the flaps of skin are advanced into the anal canal. The mucosal edges are reproximate in their normal anatomic position with sutures. The skin incisions are closed, completing the procedure. Pharyngoplasty, plastic or reconstructive operation on pharynx. A variety of techniques may be used for pharyngeal reconstruction, including skin grafts, tongue flaps, regional cutaneous flaps and microvascular free tissue transfer. Skin grafts are commonly harvested from the forehead, deltopectoral, nape of the neck, and pectoralis major. Reconstruction is performed when direct wound closure or reapproximation is not possible. Anaplasty, plastic operation for stricture, adult, infant. An incision is made in the scar of the stricture and a portion of the stricture is excised. Incisions are extended onto the perianal skin and subcutaneous tissue, and skin flaps are mobilized and advanced into the defects created by the scar excision. The flaps are sutured to the surrounding skin and anoderm, thus closing the defect. Pyloroplasty. The physician repairs the pylorus. The physician makes an upper abdominal incision through skin, fascia, and muscles to expose the pylorus, a muscular band surrounding the distal opening of the stomach. A longitudinal incision is made in the pylorus. The incision is closed with a single full-thickness suture layer.